Hey, everybody, and welcome to the Pragmatic Leader Podcast. We have with us today Vishal, who has been in the health tech sector as a AI product manager for a while now. I think, if I'm not wrong, Vishal, pretty much your entire career you've been in the health tech space.
For 3 years, I've been into health tech. Rest, I've been into e-com, insurance, insure tech, and
So 3 years, you would have seen a lot of the latest advancements that have come about in
yeah.
health tech. So you would have probably stepped into it just as a lot of these changes started happening. So tell me something about this. Sorry, go ahead.
So basically, I would touch upon things which I have worked upon, and then maybe things which I have not worked upon, which is common across the whatever is happening in health industry 5.0. But things that I worked upon is more about wherein AI is coming into the picture, wherein the documentation, there are different type of documents in terms of there's a lab report for a patient, there is a prescription for a patient, there's a pharmacy bill for a patient, there are n number of document types. How can AI help to collect all the document of the patient and finally organize in a much proper way and then finally show it to the end customer, wherein you go to a doctor and then you seeing go open your WhatsApp and then go through where is my report, or open your Gmail and then see where is my report. So documentation collection and organizing it in a much proper way and showing it to the patient is something I think AI can help. Along with that, the data part, wherein how can I use a patient's data. So let's suppose there is a lab report. How can I use a lab report to have convert it into a smart lab report, wherein if you get a lab report from Letlife Healthy and Thyrocare, patient browses through the report, but he doesn't understand anything. It's only the ranges and all they get to see. So how, at an aggregate level, patient gets to know how many parameters are normal, borderline, abnormal, and then apart from base readability, solving readability issue, how can I give more information to the patient in terms of at an test level, what are the causes, what are the significance, what is the trend of a particular test over a certain period of time. So how can I show better representation of the data? How can I throw some more? How can I throw some insights around the data? And finally, using all this data, how can I recommend some wellness programs for the end customer?
Okay. So you've spoken a lot about the use cases that you're working with, right? Uh, so I have one question on the use cases, and my second question a little more on the tech side. So there is a lot of personalization that is involved in what you are saying. So I'd like you to tell me a little bit more about that, how you guys understand that, number one. And number two, what are some of the most promising technologies in the health tech AI sector which is being leveraged by organizations today?
So talking about personalization, I think health tech as a space is something wherein personalization is there. मतलब आपका the report that you have, the report I have, it would be completely different. And apart from, let's suppose you get today you get your lab report. I scan your lab report, but lab through lab report I cannot give a complete picture of what's your overall health being is. Wherein I taking my case only, I had fatty liver for around 3 to 4 years, but every time I used to go to the doctor, they used to say start taking medicine for liver. Sorry, my bilirubin was high. They were giving me medicines for jaundice.
Hmm.
So I didn't tested cholesterol. I didn't do any preventive health checkup. So in preventive health checkup, you have comprehensive checkup of your complete blood vitals. But I was testing for bilirubin for around 2 to 3 years. But I was not doing a preventive health checkup. Every time you used to go to the doctor, they used to tell you are suffering for Gilbert syndrome, which is found in less than 1% of the audience in India, population in India. And then I was taking the medicines and then somewhat it was not helping. Then COVID struck and then my parents told, why don't you go for a complete checkup of your body? When I went for a complete checkup of my body, then my cholesterol was high. So then I Then I went to the doctor, and then he said, you are not suffering from any Gilbert syndrome and all. It's just
Wow.
that your cholesterol is high, so that's why your bilirubin and other biomarkers are also not up to the mark. You start taking medicine for cholesterol, and then
Right.
you should be fine. And then I started taking medicines for cholesterol, and then it was fine. And then one fine day, I just for a second opinion, I went to one of the doctors in Pune, and then he told, medicines is fine, but you need to stop the medicines in some point of time, and then you need to prevent this. It's not that you keep on taking the medicine since you are very early age of your then he told, reduce your weight by 5 kg, focus on your diet, focus on your fitness, and now everything is absolutely fine. So what I'm trying to convey here is, it's how do you take into consideration different parameters of a patient in terms of his lifestyle habits, in terms of his lab report, and and then the family history, and now we have DNA test also coming into the picture. So
Hmm.
how do we club everything, and then the doctor has more information about the patient before he is writing the prescription. Generally, what happens that someone goes to the doctor, he doesn't have, there's a large queue, and then he sees the lab report and straight away he prescribes some medicine. But how can we give more information to the doctor, and then how proactively he can see all the information and then prescribe the right thing to the end patient? So that is very much important, and
Yeah.
therein this is the, here AI can come into the picture. So we have ABDM. So we have a unique ID, 14-digit unique ID, wherein all the patient health records are there. So using the patient health record, maybe he has visited a hospital, and then he had done some tests or some scans, and then he has got done some doctor consultation. He has some 3 years prescription, and then he has bought some medicines. He has gone to the gym, and then he has connected his devices, and then he is doing some activities. So how we can use AI to club all these data points and then throw the information to the doctors? Herein when we can have a much personalized experience to the patient.
Very, very, very valid point. Very valid point. And towards the technologies.
Technology. So right now where I'm working, it's mostly in-house only, wherein we have our in-house team wherein we extract all the data points through OCR and all, and then we run our own AI models, and finally whatever programs and all we recommend, it's all in-house only where I am working.
So, what are some of the
Industry.
fascinating technologies that are appealing to you as you read about it and everything?
Industry as a whole, I think AI is one of the picture. It's like chat GPT use kar lo, Gemini use kar lo, but it's more about solving use cases for the industry, instead of basis use cases. The models may change, but solving for use cases as a whole is more important, as per my point of view. And two use cases I have already touched upon. The third use cases would be more around the administrative bit, wherein there are a lot of manual work that is being done in Tier 2 and Tier 3 hospitals, and some of Tier 1 hospitals also, wherein the clinicians, the paperwork that is being done, that can be completely digitized. And then the lot of procurement of the medical equipment and all, that can be digitized. So the administrative bit can be completely changed through AI. And then the telemedicines bit. So as of now, in the Tier 1 cities, people are doing doctor consultations online. But if you go Tier 2 and Tier 3 cities, even though 5G penetration is there, still people are quite skeptical of doing an online consultation. Samne wala doctor hai, I went there and then I get my things done. But places where medical accessibility is not there, hospitals are not nearby, how can I provide the medical services to the patient? That is something I think AI can help. And then the robotics bit, how do I reduce the patient recovery time, all those surgeries and all what are happening, how can robotics come into the picture? And then the medical imaging bit also, how can improve the accuracy of the images? So there also, I think the AI can help.
This is some very, very valid use cases that you're talking about. Yeah. And so coming back to one point you mentioned right in the beginning, which is about the data of our users with the one unique ID, correct? So what are some major ethical considerations or challenges you see in the Indian AI healthcare sector, which one needs to be very, very thoughtful about as we move ahead?
So we need to very thoughtful about how we are consuming the data of the patient, wherein there are companies. So I myself have been experienced to company like Ika Care, wherein I had a very good experience wherein they take the consent of the users before accessing the data. So I think data privacy will play a huge role in health tech space, because as soon as so let's suppose there's an agent wherein I selling some programs, and then the agent is selling आपका cholesterol high है, and then we have a heart management program,
Hmm.
and then I guess companies can get into the trouble wherein they are actually reading the data. So I guess the AI models should be trained in a way wherein we are not completely reading end to end to the toe information of the users. It's just that we are reading whatever is required to recommend something which can improve the overall well-being of the user.
We were talking a little bit earlier about this project that I was doing with one of the Ivy Leagues and one of the government organization here in India, where we were essentially trying to deeply understand health across rural India, and we were doing surveys essentially. And apart from that, we were also trying to use image recognition technology to identify where the hospitals are, where the tube wells are, and various other factors which contribute to how health is managed within villages, right? And for them to be able to use Google Maps or anything to just be able to quickly find things, because that is where a lot of problems arise. So while these are three different use cases, one of the things that we found when it came to user data, right? Whether it is somebody consuming what you are providing, or whether it is somebody essentially getting in touch with you for for patient monitoring, whether it is an electronic health record system, whatever it be. I found a lot of organizations in India don't understand the concept of anonymization and aggregation. Uh, and I found it very interesting to the fact that people say, okay, fine, let's just mask the mobile number, or let's just mask the name. And therefore, we are not subject to PII discrepancies. But there's so much more than that. Right? So something like aggregation and anonymization. Could you tell me a little bit how, like real world scenario for you, how these two are so important?
Yeah, you touched the right thing wherein if we encrypt, decrypt the data, or we marks the data. So these things are there, but however, what you were conveying ki isse bhi, I don't think the problem will maybe can be solved to some extent, but not full extent. So that's what I said earlier in terms of how do we in the during the model phase zero of the model itself, wherein we are setting the guardrails or the principles in place,
Right.
what that is something which is
Right.
more important, instead of using all those sort of techniques and then conveying it that we are not reading your data. Instead of that, I think the right guardrails should be in place, and then as an organization, whoever is working on the patient data, they should have those principles set up with the complete right from the top of the organization to the bottom of the organization, and then it should completely flow within the organization. Then only it can be set up and data can be used properly, or else it can go haywire if we don't set the principles in place in the first phase itself.
That is bang on what you said, right? Which is in the beginning itself, how you set things up and what are the principles that you follow are very, very vital as to how you go about progressing over a period of time. This has been a very, very interesting conversation. I would love to hear from you your personal overall thoughts on, how the space is evolving, any other opinions you have.
I think something so on the devices bit I have not touched upon. I went one of the health summits in Pune, wherein the government is also working towards that in terms of, let's suppose I want to get my ECG report or any other report, MRI scan report, n number of reports. How can I get in a fraction of second, and then how can I make devices which are very cheaper, wherein
Mm-hmm.
and how all these devices can reach to your home, and then something which patients can also do on their own, or maybe someone who is a clinician can go to the patient's home, and then he can do all sorts of this MRI scans and all, instead of going to the offline channel and then getting, and then also waiting for a few hours and then getting the report. So that process is quite cumbersome. So the devices which I think is something that can be worked upon, and government is also, I guess, is on the part to solve for that, or cheaper devices for all those scans and all.
Noted, noted, noted. Okay, superb. I firmly believe that there is a lot that can be done in this space.
Yeah.
And while a lot of focus is going towards the physical health, right? I'm also seeing this difference now of startups wanting to focus on the mental and emotional health tech space, right? Which I think is a huge advancement when you come to the kind of users that sit in India. To have an opportunity to open up this space for this sector, which is mental and emotional health, with the AI landscape now, is, I think, something which is really, really opening up, and it's beautiful to see. Yeah, and so that's my last. It's been a fantastic conversation with Vishal on understanding the health tech space from someone who's working in it, and we're always fascinated with what next is going to happen. Thank you, Vishal. Thank you so much for this. Really appreciated you and the time that you've given in your thoughts.
Thank you, Amit. Thanks for taking me part in this.
Thank you.